The fact of the matter is that what we are now talking about doing, most of the countries of Europe did years ago. The British did it 30 years ago. We are behind every country pretty nearly in Europe in this matter of medical care for our citizens. And then those who say that this should be left to private effort. In those hospitals in New Jersey where the doctors said they wouldn't treat anyone, who paid their hospital bills through Social Security, those hospitals and every other new hospital, the American people, all of us, contribute 1/2, 1 or 2/3 to every new hospital, the national government. We pay 55% of all the research done. We help young men become doctors. We are concerned with the progress of this country. And those who say that what we are now talking about spoils our great pioneer heritage should remember that the West was settled with two great actions by the national government. One, in President Lincoln's administration, when he gave a homestead to everyone who went west, and in 1862 he set aside government property to build our land-grant colleges. This cooperation between an alert and progressive citizen and a progressive government is what has made this country great, and we shall continue.
The issue that we're talking about today is about fundamental rights, and it is about ending the disgrace, the nationalist disgrace, that the United States of America remains the only major country on earth that does not guarantee health care to our people as a right of citizenship. Health care is absolutely a human right, whether you're rich or whether you're poor or whether you are in the middle class. Every person in this country has a right to know that when he or she gets sick, they're not going to face bankruptcy. They're not going to delay going to the doctor because they can't afford the deductible. That they know that they go to the doctor, they go to the hospital when they need to because they are a human being entitled to health care. That's point number one.
Mr. Martin, in your testimony, you note that Canadian doctors exiting the public system for the private sector has had the effect of increasing waiting lists for patients seeking public health care. Why are doctors exiting the public system in Canada?
Thank you for your question, Senator. If I didn't express myself in a way that made myself understood, I apologize. There are no doctors exiting the public system in Canada, and in fact, we see a net influx of physicians from the United States into the Canadian system over the last number of years.
Point number two. And what we say to our conservative friends who talk about waste every single day, there is no healthcare system in the world that comes close to being as wasteful and bureaucratic as our system. Why are we spending 30% of every healthcare dollar on administration and bureaucracy? We should be putting that money into doctors, into nurses, into disease prevention, into keeping our people healthy.
What would be wrong with a medical system that does treat people reasonably at a cost? Medical
I agree with that.
Crazy.
I agree, and I fully subscribe to the fact that we have to take care of the people, but there are much better systems. The people that had good plans are losing those plans, and they have deductibles that are through the roof. They can't have their own doctor. They can't have their own plan anymore. That was not the way it was sold. It was sold much differently than that, and people are being really badly hurt, and it doesn't really kick in until 16, and it's going to have a devastating effect on the economy. You can have a better plan for less.
I don't know enough about it to say that's not true, but I think that's not true.
Okay. I mean, I'd like to see. I would like to see a plan. I would like to see a plan that could be better and cost less for the people. And you can do that.
I've told this story many times. I have traveled to other countries, and while in the other country, I have injured myself. And I have had to go to a hospital or to a clinic and had myself taken care of.
Right.
And in one case, it was I had an arm reattached. And at the end of the procedure, they said here, they wrote me up, they said go to the, it was like $12.
Yeah.
$12.
No, it's true.
So now, what would be wrong
Well, I
with that?
had an instance in Scotland where a friend of mine was in Scotland recently. He got very, very sick. They took him by ambulance. He was there for 4 days. He was really in trouble. And they released him. And he said, where do I pay? They said, there's no charge. And not only that, he said it was like great doctors, great care.
Yeah.
I mean, we could have a great system in this country.
We recently, a couple of months ago, I had the ambassador from Denmark visiting the state of Vermont. They provide health care to all of their people without out-of-pocket expense at 50% of what we are spending, when we end up having tens of millions of people uninsured, people paying large co-payments and deductibles. So to our conservative friends, if you want to stop wasting money, let's pass the cost-effective way to provide universal health care to all of our people, and that is through a single-payer system.
Dr. Martin, in your testimony, you state that the focus should be on reducing waiting times in a way that's equitable for all. What length of time do you consider to be equitable when waiting for care?
Well, in fact, the Wait Time Alliance in Canada, sir, has established benchmarks across a variety of different diagnoses for what's a reasonable period to wait. And what we've found is that actually working within the single payer system, we can reorganize things. You know, I waited more than 30 minutes at the security line to get into this building today. And when I arrived in the lobby, I noticed across the hall that there was a second entry point with no lineup whatsoever. Sometimes it's not actually about the amount of resources that you have, but rather about how you organize people in order to use your queues most effectively. And that's what we're working to do, because we believe that when you try to address wait times, you should do it in a way that benefits everyone, not just people who can afford to pay.
On average, how many Canadian patients on a waiting list die each year? Do you know?
I don't, sir, but I know that there are 45,000 in America who die waiting because they don't have insurance at all.
I live 1 hour away from the Canadian border. Canadians watch American television. Canadians are very familiar with our political system, probably know more about politics in America than most Americans know. Is your Prime Minister a socialist?
No, sir, our Prime Minister is quite conservative. He's the leader.
Conservative?
Yes, indeed.
So obviously, as a conservative, he wants to implement the American healthcare system that the Canadians are very aware of. I gather that was probably the first thing he did when he took power, is that right?
Not exactly.
Why not?
Support for single-payer Medicare in Canada goes across all political stripes. Quite famously, we had the leader of the most right-wing party in the Canadian federal debate on television hold up a sign in the middle of the debate on which he'd written in marker, "No two-tier," as a means of trying to reassure the Canadian public that if elected, he would not dismantle the
In other words, you have a nation bordering on the United States, two nations that are probably as close together in so many respects as any two nations in the world, a conservative prime minister, and yet there is no effort to move to an American healthcare system. I would say to my colleagues, there's not a better example of maybe how people feel about two systems. They know the American system. They have a conservative prime minister. They can move in our direction, but for whatever reason, I think sensible reasons, they understand that a system that guarantees health care to all of their people in a cost-effective way is the way that they want to stay.